Hello, dear aquarist. Thank you for selecting this video because you want to learn something about the silver shark, Balantiocheilus, that comes down, in this case, with wounds on the skin. And of course, a proper examination while using a microscope can help us to find the cause of this disease. And we will give suggestions what you can do about it. So I will share you my PowerPoint and my findings about the Balantiocheilus that has a bacterial infection and also some tubercles. Fish diseases can be found in more detail in my books, How to Prevent, How to Diagnose and How to Treat. See the link below. Here we see the Balantiocheilus and we can see here the red bleeding part of the side of the body. And usually bleeding parts in the body we find quite often that is caused by bacteria. The other fish, some are coming down and some doing better than the other ones, but it was advancing and more fish came down with those reddish wounds that you could see here, and they were dying. And this is an advanced infection in this case, and a medication will not help, but it might help the ones which are still in the aquarium and have little infection going on the moment. But we took the scraping of the scales of the Balantiocheilus. We found a lot of bacteria here on the scales, but we also found the deformed scales. You can see here on the left, and here we can see on the right, those deformed scales. Here are bacteria, that dark part here. But this deformation of scales, I already explained that in previous videos, is quite often caused by mycobacterium that is affecting the general health of the fish. In this Balantiocheilus, we also found badly affected gills. You could see that some parts of the gills will not do a proper job anymore for the gas exchange. Internally, we found a massive amount of bacteria, different kinds, and a lot of rod-shaped bacteria. You can see here all the little rods. At the same time, we found also tubercles. You can see them here at the right, all tubercles next to the intestine. And here parts of the organs, and here the parts of the mesenteria that are affected with tubercles. So this is a serious bacterial infection. When the fish come down with red wounds, well, that might be too late to cure in this case. So better to euthanize the badly infected fish, and it will also help to avoid the spreading to the other fish which are still in the aquarium, because the disease will grow inside the fish, on the fish, and easily spread in your aquarium to the other fish, particularly when it's the same species in the aquarium. Try to check the origin or the cause of this infection. I have several videos on causes and origin of fish disease that might help you to understand. Here it might be food, bad water, stress, bad handling, bad filtration, bad water change. Who knows? You have to check for that. We also found some mycobacterium or fish tuberculosis in the tubercles, but not yet very advanced. So a treatment might be still possible with an antibiotic on the condition that you do a proper or correct application of the medication. Ask your vet or ask your fish doctor how to use and what to use. Also, my books explain you all about that. You can also help to improve the health and immunity of your fish with a functional fish food. We would recommend Dr. Bassleer, a biofish food professional treat, or FICO. My books help you to understand fish diseases and apply the correct treatments. There's a lot of details on treatments and medications in these books. You want to become a more specialized aquarist? Well, try to follow my fish doctoring training that I provide at my Patreon channel. So I thank you for watching this video on a specific bacterial infection from the silver shark, or on the silver shark Balantiocheilus. I hope this teaches you a lesson. Thank you for watching.